Welcome to HBOT Journal, a channel dedicated to understanding hyperbaric oxygen therapy through evidence, science, and experience.
So you're thinking about hyperbaric oxygen therapy, or HBOT. Before you even get close to the chamber, there's this really critical step that has to happen first, the safety screening. Now we're going to break down why this isn't just some paperwork or a formality. It's actually the entire foundation of a safe, controlled medical process. So let's get into it.
You know, when you ask most people what HBOT is, they'll usually just say two words: oxygen, chamber. And, they're not wrong, right? On the surface, that's what it is. But that simple description, it completely misses the most important parts, the stuff that actually makes it a real therapy.
So is it really that simple? Absolutely not. No way. What's happening inside that chamber isn't like, just hanging out in a high oxygen room. It's a very carefully managed process. And to really get it, you first have to understand who is, and just as importantly, who isn't a good candidate for it at any given moment. And that brings us to the heart of it all. HBOT is what we call a controlled exposure. It's intentionally creating a very specific physical environment, one with a lot more pressure than you're used to, and your body has to be able to handle it safely. It's that control, that careful management of the environment that makes it a therapy and not just, an experience. Yeah, it's so important to think of the chamber as a specific medical environment. It's not a spa treatment or some wellness amenity you just sign up for. And once you make that little shift in how you see it, the whole screening process makes perfect sense. It's not about judging you, it's all about checking for compatibility. So let's be super clear about this. The screening is not asking, is this person worthy of HBOT? That's not it at all. The real question is way more practical, it's based in physics, and it's this: can this person's body safely handle this specific environment right now? See? It's just an assessment of fit. It's got nothing to do with worthiness. Okay, so how do we figure out that fit? Well, in medicine, we use this term called contraindications. Now, that might sound a little intimidating, but they aren't just a bunch of random rules. Think of them more like safety signals, telling us how the physics of pressure might interact with what's going on inside your body.
Yeah, a contraindication is just a safety signal. All it means is that if you have a certain condition, the risks of going into a pressurized environment change. It's like a little red flag that pops up and says, whoa, hold on a second, we need to take a much closer look at this.
And these signals, they basically come in two flavors. You've got your absolute contraindications. That's when the pure physics of the situation just says, nope, this is unsafe. Then you have relative contraindications, where the context around your situation says, let's just wait a bit and reevaluate this.
The easiest way to think about this is like a traffic light. An absolute contraindication, like an untreated pneumothorax, that's trapped air where it shouldn't be, that's a hard red light. Full stop. The physics of putting pressure on that trapped air is just way too dangerous. But a relative contraindication, maybe like a recent surgery or even just bad sinus congestion, that's a yellow light. It means slow down, be cautious, we might need to delay things, but it's not necessarily a permanent no.
And this gets us to the real why behind the screening. Because so many of these potential risks, the things that trigger those red or yellow lights, are completely invisible. You could look and feel totally fine on the outside, but be carrying a risk that only shows up when you're actually under pressure.
Just think about it for a second. When you're on an airplane taking off, what's the first thing you feel? It's not your skin, right? It's your ears popping. It's those internal air spaces, the parts of you that you can feel, but no one can just see by looking at you.
And that's exactly what the screening is looking for. It's zeroing in on all those air-filled spaces. The pressure directly impacts your middle ears, your sinuses, and your lungs. It can even affect tiny little air pockets in dental work or around medical implants. The whole point of the screening is to find these invisible risks before you even think about stepping into the chamber.
So, here we are, back at this central idea, and it's a really reassuring one. I'll say it again. Screening is not a test of worthiness. It is a deeply practical, purely physical check for compatibility. It's just about you and this very specific medical environment. Okay, but passing the screening, that's really just step one. Because safety also hinges on another huge factor: everyone is different. Seriously, no two people respond to pressure in the exact same way, even if their medical charts look totally identical.
And this right here is exactly why a one-size-fits-all approach is just plain dangerous. You can't just copy someone else's protocol. It's unsafe. Our bodies are all different in these tiny but super important ways. The shape of our eustachian tubes, how we handle a little bit of anxiety, our own personal healing clock.
Look at this. It shows it perfectly. You've got patient A and patient B.
Identical medical histories. They both start the session. Patient A is doing great, adapting smoothly, but patient B starts to feel some discomfort and needs a pause. This is where a trained operator is key. They see this and they adapt the protocol in real time just for patient B. Remember, the chamber doesn't change, the protocol has to change for the person. Which brings us to our last point. And honestly, this might be the most important one of all. Sometimes the absolute best, safest, and most professional thing a clinic can tell you is no. Or more likely, not right now.
Think about it. A truly responsible center isn't going to rush you through the door. They're going to ask a ton of questions. They're going to review your history carefully. And that caution, that's not them hesitating. That is the #1 sign of a high-quality, professional clinic that puts your safety before anything else.
So if you take one thing away from this, let it be this. In HBOT, caution is not hesitation. It is competence. It's the mark of a true professional.
All right, so let's wrap this up. The best way to see all this as a safety filter. First, HBOT is a controlled medical environment. Second, the screening is just checking your physical fit for it, not your worth. Third, those safety signals we talked about are all based on physics and context. Fourth, the protocol has to be flexible enough to adapt to you. And last but not least, a professional no is actually a really good sign.
At the end of the day, hyperbaric oxygen therapy is selective, and that's by design. That selectivity isn't meant to be a barrier to keep you out. It's a protective feature. It's what guarantees that control and supervision, which are the absolute cornerstones of safety here, are never ever compromised. Because as we've talked all about today, safety is everything. The entire structure is built around it. And that's why you'll see that different designs exist for different contexts, and always under appropriate supervision.
To continue learning, explore the HBOT Journal channel.